Welcome and thanks for joining us. My name is Kara Bloomberg and I'm the Chief Operating Officer of LandrumHR. I believe this is the 10th webinar in our series related to COVID legislation, and we are so thankful for you to join us today. For those of you that aren't familiar with LandrumHR, we're a professional services firm with 50 years of serving clients across the country. We provide PEO, or full service augmented HR, that includes payroll, benefits, workers' compensation, and compliance HR. We also provide worksite management, which is a customized labor solution for companies that use large numbers of temporary workers. Our HRQ division provides 3 integrated services: enterprise-wide human capital consulting, providing interim HR talent, and conducting searches for HR professionals. Our consulting team brings a depth of experience in workforce planning and analytics, talent management and talent strategy projects, org design, and HR transformation needs. In addition, we provide HR on-call services and virtual learning offerings. You can find out more about all of our services by visiting our website, LandrumHR.com and HRQinc.com. A recording of this webinar will be sent to everyone who registered today. Please feel free to ask questions using the question pane in our control panel, and we'll try to get to some of those questions live at the end of our presentation. The handout pane includes some information that our speaker, Amie Remington, will be referencing today. And there'll be a quick survey that pops up as you exit the webinar today, and we would appreciate your feedback. So it's my pleasure to introduce Amie Remington, General Counsel for LandrumHR. Amie spent the last 15 years of her career at LandrumHR. Amie has over 20 years in the employment law arena and is a national speaker on employment law topics. One of the things that we want to do today during the presentation is, as we have hundreds of people on from across the country, is get your thoughts, get your status, hear more kind of about where you are. So as we go, we'll ask a series of poll questions and would love for you to participate. So Amie, before you jump into your presentation, I want to ask the first question. So I'm going to get this poll launched. And the first question for everyone on is, what's the current status of your operations? Are your employees mainly remote? Are employees mainly back on site? Or do you have a mix of on-site and remote employees? We'll just take a couple of seconds here and ask if everyone could participate. That would be great. And we'll get a good sense of where people are as far as returning back to their physical location for work or working remote. All right, and I'm going to close it out now. And Amie, there we go. Here we go. We had a good response. And we had 8% employees are mainly remote, 61% employees are mainly back on site, and 32% have a mix of on-site and remote employees.
Gosh, Kara, that's I would have lost if I had bet on those numbers. I would have thought a lot more would still be remote. So that's super interesting.
Me too. Yeah, really interesting.
I'm glad I didn't take your bet. So this year, in this 10th webinar that we've done, and I can't believe it's been 10, but it's the year of federal legislation. I mean, Congress has been busier this year than I think that I have ever seen them. This year we've spent a lot of time talking about the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. And we spent a lot of time talking about the Families First Coronavirus Response Act, which I'll probably call today the FFCRA, because I tend to use that abbreviation rather than saying the whole thing. And you're going to recall that the CARES Act contained the Paycheck Protection Act, which is the PPP, and that provided relief for businesses who had fewer than 500 employees. The FFCRA contained both the Emergency Paid Sick Leave Act that benefited employees and the expanded FMLA, which I refer to as the EFMLA. These federal laws were all created in 2020 by Congress to specifically address the COVID-19 pandemic. And to be honest, for employers, it's an overwhelming amount of new legislation. But just as a reminder to see how large this is, the CARES Act provided about $367 billion in forgivable loans to United States businesses. Remember, it provided for the expanded unemployment benefits and the amount of about $600 per week per employee for about a 4-month period. It provided for stimulus payments for families who made less than $75,000 a year. In that case, adults got about $1,200, and there was a $500 per child stimulus for those households. Over $130 billion was provided to healthcare, to hospitals and healthcare providers and hospital systems and healthcare systems. And then there were substantial loans to corporate America, $500 billion to keep corporations in America afloat during this time. There were $30 billion to the airline industry alone to make sure that our planes were still safe and in the sky and able to continue business through the year. And about $150 billion to state and local governments. So there was a lot of money spent this year through the CARES Act, all done with the purpose of keeping Americans afloat. But before we start and launch into the FFCRA, Kara, I think you've got another poll question related to the FFCRA.
Yeah, thanks, Amie. We wanted to see how many employees that you have at your site that have taken advantage of the leave that was offered under the Families First Coronavirus Response Act, or FFCRA. So here's the next poll, and just wanting to know more about your employees and how many have taken advantage of the leave. So none, 1 to 20% of your employees, 21 to 40%, 41 to 60%, or 61% or more of the employees took advantage. And we'll just take a couple more seconds here and collect responses. All right, Amie, here's what we saw on this one. So the majority, 45% saying none. The majority, 52%, responding that 1 to 21 to 20% of their employees took advantage of the leave, and then a small percentage, 3%, saying that the 21 to 40% of their employees took advantage of the leave.
So those numbers don't surprise me, because when we started talking about the FFCRA, we anticipated that a lot of employees would take leave. But then as our clients were communicating with us, we just didn't hear about it as often as I had predicted that we would. So I guess those numbers don't surprise me in hindsight. So, but with respect to the FFCRA, the law actually expires on December 31st. So it's right around the corner. The expiration applies to both portions of the FFCRA, and that means it applies to the Emergency Sick Leave Act, which covers the first 2 weeks of leave, and it applies to the expanded FMLA, which provides up to 10 weeks of paid leave after the emergency sick paid leave is taken. So even though it expires on December 31, which is around the corner, there are some obligations that employers need to make sure that they are complying with. So employees can still continue to request and take leave up until December 31st. So if you have somebody who comes to you tomorrow and they don't have a full 12 weeks of time, they can still take it up through December 31st. But you need to make sure you remain compliant with the requests. So for example, record keeping obligations continue. All documentation related to the leave requests must be maintained in a secure manner for however long your records retention policy requires. If you don't have a records retention policy that talks about leave, then at a minimum, I would recommend that you maintain all records related to leave for at least 3 years, because that is generally going to be a safe amount of time given the statute of limitations. Also, because the records are medical in nature, you want to make sure that they're maintained confidentially as you would with any other medical record. It's to be treated like any medical document, because It does have a lot of medical information on there. And I would say the same is true, even if it's for school closure and not for medical reasons. So your obligations continue past the date of the expiration. One source that the LandrumHR has used on a daily basis to help our clients and answer every sort of question available has been the U.S. Department of Labor's website. It is robust, and they have done a very, very good job of keeping it up to date. They have a frequently asked questions, a Q&A that's available on the website, and currently, with respect specifically to the FFCRA, there are over 100 questions that have been asked and answered, and very specific with examples and deadlines and links to regulations. So it's very robust. There was a lawsuit that you probably heard about called New York versus Scalia, and it challenged some of the Department of Labor's Q&As and some of the guidances and the regulations. So in response to the lawsuit on September 11th, the U.S. Department of Labor issued some revised regulations on specific topics. The remainder of the FFCRA and the regs and the Q&As remain. And the changes are listed on the website, but I'm going to go through some of those changes because I know these are changes that will affect some of our clients depending on your industry. So the first one relates to our healthcare clients. One change that was made on September 11th was the clarification of who qualifies as a healthcare provider, because there's a rule that healthcare providers are exempt from the FFCRA leave requirements. So the question on the Q&A reads, who is a healthcare provider who may be excluded by their employer from paid leave and or expanded family medical leave? And the Department of Labor, in its update, clarified that a healthcare provider is not somebody who merely provides a service that's related to healthcare. So if you work in the healthcare industry, but you are in information technology, or if you are in facilities maintenance, or you work in a cafeteria or a restaurant or a coffee shop within that healthcare facility, if you are a billing person or an admin person or in the legal department, even though you do all of those things for a healthcare facility, you're not exempt. Instead, the exemption applies to those healthcare employees who are, one, already defined as healthcare providers under the existing FMLA. And so that would be your doctors, your direct practitioners, your RNs, your PAs. Those people would definitely be covered. But it also covers those employees who are considered diagnostic, in that they work specifically with diagnostic tests, or they work preventive maintenance. And by that, I mean they do your screenings, they do counselings, they do things to prevent illnesses. Or people who provide treatment of any sort at all. If you actually are hands-on with a patient, that's treatment. Or they've got a last category called integrated employees, and those are employees whose services are so integrated into the direct treatment of patients that they would be considered hands-on. So those people are exempt from the regulations. And if you look at that question on the website, you'll see that it reflects an update on to say that's current as of September 11th. The next update that they made to the regulations applies to all types of employees in all types of industries. And it relates, if you look at questions 24 to 27, there's a cluster of questions about leave entitlement. And the rule on work availability is this: if an employer has work available and an employee needs leave, the person is qualified for the leave. But if the employer does not have work available, then the employee is not qualified for the leave because there's no work from which to take the leave. So in other words, if the work is not available because the employer has put somebody on furlough, or if the work is not available because, say, your business is shut down, as was the case in like dental offices in March and April and May of this year, then there's no work from which to take leave. So leave wouldn't be available, which makes perfect sense. Now, Department of Labor does specifically say that the employee's FFCRA reason for leave must be the sole reason that they're not working. So in other words, an employer cannot create a reason to create work that's unavailable, because that would be considered a pretext or pretense to prevent somebody from taking leave. And that's a risky proposition. You want to stay away from that for sure. The next thing that would apply to all types of employees and all types of industries would be the definition of intermittent leave. Under the regular FMLA, intermittent leave is when somebody needs time off, but they don't need it in one cluster. So maybe they need 4 hours a day, or maybe they need Monday and Friday, but not Tuesday, Wednesday, Thursday. So they need it intermittently. So the issue is whether an employer under the FFCRA must honor an employee's request for intermittent leave. And so the Department of Labor took a very reasonable approach. And they said, dear employer, you should balance the employee's need for leave with your interest in avoiding disruptions. So the Department of Labor recognizes that you need to continue to run your business, but they also recognize that employees need time off. So it's saying you need to balance this. So the best advice that we can give you is that if an employee comes to you and says, I need intermittent leave, that you have that conversation with the employee to determine, how does this affect your workload? Is there a way that the intermittent leave could work? I would recommend not just unilaterally just denying leave because it's inconvenient. I think you would get in trouble. Instead, you want to be able to show that you engaged in what looks like the interactive process under the ADA, for example, the interactive process of having a conversation and saying to the employee, this works for me, let me see what works for you, and working together. And this question, interestingly, also defined intermittent to exclude leave taken due to a school being on a hybrid schedule. So that's specifically excluded. And if you have questions about schools, there's a whole section about virtual schools, hybrid schools, in-person schools. In-person schools when your school gets shut down because one child in a class gets sick. So lots of questions in the Q&As about that. Finally, the last topic that pertains to every employer is relates to documentation. It clarified the information related to documentation and notice. And what the Department of Labor said is that we're going to follow the current FMLA regulations, which say that an employee is not required to provide documentation before leave in every single situation. And that makes perfect sense under the regular FMLA, because if I, for example, had a car accident and went straight to the hospital and were hospitalized overnight, I certainly could not have provided an FMLA request to my employer before that happened. But instead, I have to provide that FMLA request as soon as I'm able to do so. So in this situation, the Department of Labor recognized that sometimes leave can't be provided, or the notice can't be provided ahead of time, such as if a school gets shut down suddenly and without notice to you. If your children are in school on Wednesday and you pick them up Wednesday afternoon and they say, we're shut down for 2 weeks, your employees need to provide the notice as soon as practical. So that's something that affects all types of employees in all industries. So those are the primary changes to the Department of Labor's frequently asked questions. And one of the other things that I wanted to talk about is reopening plans, because many states are preparing to reopen in part or in full. So for example, in Florida, Governor DeSantis just signed Executive Order 20-244. And what that executive order says for all Florida businesses is there's unrestricted staffing of work sites. There's implementation of the final phasing in of employees returning to work. The executive order says employers should continue prudent and practical measures to ensure that employees do not come to the work site if they're believed that they're sick and have any kind of influenza, COVID, any infectious disease. The executive order provides for resumption of non-essential travel as long as you're adhering to the CDC's current guidelines regarding isolation following travel. And it provides that all retail businesses can open at full capacity. So based on this reopening trend, businesses need to anticipate a few things. And I thought to myself, if I were running a small business, especially a business that caters to the public, like retail or hospitality, what would I want to anticipate? What questions would I want to anticipate? And the first one would relate to safety. So employers need to be prepared to respond to questions related to safety measures. This means that employers need to be able to state that they were following the CDC's regulations and OSHA's regulations to protect both the employees and third parties, which might be patients, which might be clients, which might be vendors, it might be people who shop. So you want to be able to say what regulations you're following and what you're doing to make sure that your employees and third parties are safe. I would also anticipate questions about equity and fairness. Remind your employees about workplace rules. Remind them about your policies. It's probably a great time to go over your anti-discrimination and your no retaliation policies. I would fully anticipate questions about confidentiality, because as an employer, you are bound to get questions why certain people aren't returning to work, or why certain people are allowed to work remotely and others aren't. And then the question you're going to get at some point is, I heard so-and-so was ill, is that true? Or I heard so-and-so tested positive or tested negative or refuses to take a test or whatever. And that so falls in the category of not the employee's business if it doesn't relate to them. So you want to be able to have your standard statement that you're going to give to employees about confidentiality and respecting the privacy of everybody, and making sure that your employees are all treated fairly, even though you might not be able to explain for privacy reasons how they're all treated fairly. So I would also anticipate how you're going to handle employees and customers who don't want to follow rules or procedures. If you're a business that requires a face covering like a mask, and you have customers who don't want to follow that, your employees need a clear understanding of what they're to do. What is safe to do? At some point, do you get a manager involved? Does the manager get law enforcement involved? How do you de-escalate a situation like that? So I think you just need to anticipate that and plan for that. And then finally, with respect to compensation, the FFCRA, of course, was calculated based on wages. And so if you have an employee who took some of this leave, you need to be sure that you paid them correctly during the leave. And there's another great link under the Department of Labor's website that is specifically for wage and hour and the pandemic. It's called the Fair Labor Standards Act /pandemic. And we'll give you a link to this at the end. But it's a great way to make sure that you're paying people fairly during the pandemic. And finally, I cannot say this enough, be sure to document concerns that you have to prevent future litigation. Because prevention is such a key. I mean, I say that all the time, but I can't say it enough. So we previously talked about 2 cases related to COVID, and I'm just going to give you my 2-sentence update on those because they're perfect examples of what I think we're going to see. If I had a crystal ball, I think this is what we're going to see in the future. The first was a case involving Walmart, where an employee passed away and his family brought a gross negligence claim, and they brought it outside of workers' comp. So generally, if somebody passes away or is injured on the job, it's a workers' compensation matter. But if it rises to the level of gross negligence, the person bringing the claim can seek to take it out of workers' comp, out of that limited protection. And it's very rare that that happens, but that can happen. But his family said, this is not workers' comp, this is gross negligence, because Walmart failed to provide PPE, failed to respect social distancing, and didn't give him any way to protect himself, no protective barriers, for example, and he passed away. So they're saying it's Walmart's cause. It's Walmart, the cause and effect was he worked at Walmart and he passed away. And then the second was Smithfield Farms, which is a little different. This is where a group of employees brought a lawsuit to try to have the entire processing plant shut down as a public nuisance. And these employees got together and they alleged that Smithfield Farms wasn't taking the pandemic seriously enough and that harm would result. And they said, you know, Smithfield Farm actually bonuses people for coming into work sick, which if you think about the food industry is outrageous, right? But these aren't isolated cases. There is a wave of litigation that's being brought as a direct result of COVID-19 pandemic. Your documentation is going to be so important to show what you did all along this to keep your people safe. Because these are not traditional employee versus employer type of cases. And as with the Walmart case, they're not all workers' comp cases. Some are individual plaintiffs and some are class action cases. So I'm going to give a shout out to Fisher Phillips because they've got a litigation tracker that I've been following. And as of today, there are 894 of these cases throughout the United States. Cases where employees or groups of employees are saying that I became ill or a group of us became ill because of my employer's inactions. There's 894 of those filed currently in different courts. 193 are in California, 107 are in New Jersey, 54 are in Texas, 81 are in Florida, and Illinois brings in 29. And then there's a smattering of others throughout the United States. But my point is that this is a trend, and I want everybody on this call to exercise preventive maintenance and record keeping to make sure that you guys all have good documentation on what you have done. So we're going to move into the PPP, the Paycheck Protection Program. And as we do, Kara, we have 2 more poll questions, right?
Yes, Amie, just as we thought leave and return to work would create enough mayhem and confusion, right? We have PPP, and we've done a number of webinars on PPP, and I think plenty of our clients and people within our communities that we serve are thankful for the PPP money, but it has definitely been a journey trying to understand the application process and the forgiveness policy. So we wanted to launch this next poll about the status of your PPP loan forgiveness. So the first answer would be, I haven't applied for loan forgiveness. Second, I've applied but not received loan forgiveness. Third, I've received loan forgiveness. Or P, I didn't have, or 4, I didn't have a PPP loan. Fourth there. We'll just leave a few more seconds for some people to vote and participate, and that'd be great. All right, and we'll go ahead and close it out. Amie, 65% haven't applied for loan forgiveness yet, which I think that doesn't surprise us. That's pretty much what we're hearing, not quite yet there on applying for the forgiveness. 19% I've applied but have not received loan forgiveness. 8% I've received loan forgiveness, and 8% didn't have a PPP loan. What do you think about those numbers, Amie?
And I think that didn't have a PPP loan could be because of an employer size, for example. That may be one reason that some people did not apply for a loan.
All right, and then our last question for the day, and I hope we get some great answers to this one. When do you anticipate your revenue returning to pre-pandemic levels? 1, revenue's already begun returning. Hope we have lots of answers there on number 1. 2, we expect a return by end of the 4th quarter of this year. We expect a return by end of the 1st quarter in 2021. We don't expect pre-pandemic levels until Q2 of 2021 or later for a return of revenue. So we have everyone voting in now. We'll give it a few more seconds. And Amie, we've also gotten some good questions in.
Oh, good.
All right. So 36% revenue has already begun returning. That's great news for 36%. 7% we expect to return by end of Q4, 18% end of Q1 of 21, and 40% unfortunately not expecting pre-pandemic levels of revenue until Q2 of 2021 or later.
Well, the 36% makes me optimistic. So
yeah, that's right.
That's been a good news.
On the bright side there. Yeah.
Yes, yes. Or the 36 plus the 7. I mean, that's a good 43% total. So that makes me feel optimistic. So let's talk about the PPP, the forgiveness process. There are now 3 different applications. And like every IRS form, they're numbered, right? So you have to know what application you're looking at. They each start with 3508. But there's the 3508, there's the 3508 EZ, and then there's the 3508S. And the form you use corresponds to your loan amount. So the 3508S stands for simple. So that's the loan, that's the PPP application loan that you would use if you had $0 to $50,000. And the EZ, they really did try to make it easy. That's the 3508 EZ. If you fall in one of these 3 categories, you can use that form. If you're self-employed, you're an independent contractor, you're a sole proprietor who had no employees, or if you didn't reduce the annual salary or hourly wages of employees by more than 25%, then you can use the EZ form, which is very much like the simple form. It's when you read it, you're like, gosh, this is something I can handle. The 3508 is for everybody else. So I hope that most of our listeners can use either the 3508S simple or the 3508 EZ, because that will make your life easier. If you have to use the full form, it is a little confusing. But let's talk real quickly about the PPP loans. So the Small Business Administration, of course, has overseen this whole program, and they released guidance just, 2 weeks ago that stated that the PPP loan forgiveness applications are not due until October 31st. And they all contain an expiration date of October 31st in the corner. Now, number 4 of the Small Business Administration's SBA says that borrowers may submit a loan forgiveness application any time before the maturity date of their loan, which is either 2 or 5 years from the loan's origination, depending on what the borrower's agreement is. But the loan payments are only deferred for 10 months. So the good news is that the October 31 deadline is not set in stone, even though there is an expiration date up there. Instead, you can apply for loan forgiveness at any time before the maturity of your loan, but you do have to begin your payments within 10 months. So you probably want to go ahead and apply for that loan forgiveness as soon as you can to go ahead and maybe not make payments. So just by way of example, the SBA said if you're a borrower, employer with a covered period that ends on October 30th of this year, then you would have until August 30th of next year to apply for forgiveness before your loan repayment begins. That's the 10-month period. Now, the new form the SBA just released, it's the loan forgiveness form for borrowers with loans of $50,000 or less. And that's what you're going to see in your handout pane. The SBA has actually started approving loan forgiveness applications, and they've begun remitting loan forgiveness payments to your lenders on October 2nd. So the SBA is working hard on this, and that's some great news if you're a borrower. And it said it's going to continue to process all PPP forgiveness applications, and that they're doing it as expeditiously as possible, and they're working diligently. So in the handout pane, you'll see 3 things. If you're a borrower with $0 to $50,000, you're going to see the simple loan forgiveness application, the instructions for the simple loan application, and the instructions for the interim final rule. So you can print out all those, and they're very, very easy. The good news is it's just simple math. You have to add your payroll costs. You have to add your business and mortgage interest payments. You have to add any business rents or lease payments and your utilities. You add that up. And then on the next line, you add up those 4. On the next line, you put in your loan amount. Then you divide your payroll cost by 60%, because remember we had that webinar where we talked about the 60% has to go to payroll, that requirement. And then you'll see the amount forgiven. And so it's really just that simple. It's a 7-line form. And the EZ form is about 9 lines. So it's really, really not hard. So that's good news. But I do want to tell you a cautionary story. you do have to be able to substantiate every single dollar with documentation because the Department of Justice is actively prosecuting PPP fraud. In fact, as of August 5th of this year, there were 39 PPP fraud prosecutions already started by the Department of Labor or Department of Justice, and they had about 56 different people that they were prosecuting. So in this short period of time, the Department of Justice now owns, by the way of seizure, a 2020 Lamborghini Huracan, a Rolex President's watch, a 6-carat diamond, a Tesla, a 26-foot Havarti wake boat, a 33-foot cruiser yacht, not one, but 2 Rolls Royces, another Lamborghini, a Urus, a Kia, and a Ford F-350. So just for kicks, I Googled up the price of a Lamborghini Huracan because I wondered how much somebody could have possibly borrowed to purchase that. And the answer is they start at $208,000. So if you spent any of your PPP loan on Rolexes or Lamborghinis, which I'm sure you didn't, but if you did, I would suggest not seeking forgiveness because the Department of Labor frowns upon that, shall we say. So another challenge that we're going to go into is the constantly changing OSHA requirements. And like the other parts of the Department of Labor, OSHA has done a very good job of keeping its frequently asked questions, its Q&As up to date. But the problem is that there's been such an evolution in the rules on OSHA that it is very hard for an employer, unless they're just very, very vigilant, to stay on top of the changing OSHA requirements. By way of example, I'll tell you that OSHA initially advised that only those employers with occupational exposures to COVID-19 were required to assess COVID-19 cases for work-relatedness. So that would be only your healthcare facilities, okay? That was the initial requirement. And then in May, OSHA took the position and said all employers need to assess all COVID-19 cases for work-relatedness, which is very, very broad. Then, 2 months later, OSHA updated the frequently asked questions to require employers to report COVID-19 hospitalizations and fatalities. And then right after that, OSHA deleted that from its website and required employers to report COVID-19 hospitalizations and deaths regardless of work-relatedness or the time between the workplace exposure and the reportable event. So the problem with that is that employers have no way or very little way of often knowing if there's a connection. And so then on October 1st, just this month, OSHA updated its FAQs again and said a work-related incident is an exposure to SARS-CoV-2 in the workplace. So they defined what a work-related incident was. And then in addition to that, as if that wasn't confusing enough, there are 28 different state-approved OSHA. There are 28 different OSHA-approved state plans that operate statewide programs, and several of these states, like Virginia and California, had taken different positions on COVID-19 case management. If you have any questions related to OSHA obligations, our risk management department stands ready to assist you. And I know that they have already provided to our clients information on OSHA requirements. So if you have any questions on that, please reach out and let us know because our people are happy to help you and to navigate that. And then finally, we've got some state law considerations. And if you're an employer in many states, I'm giving you these just by way of example to show how many different rules there are related to different states. So say you've got one person in California, 10 people in Wisconsin, and 12 people in Michigan. I'll tell you what the different rules are. So if you have California employees, Governor Newsom signed executive order, it was called N6220, which created a rebuttable presumption that certain people, employees who test positive COVID contracted COVID while at work. And this was for workers' comp purposes. So they're saying if there's a connection, that there's a presumption that if somebody tests positive, then they got it at work. Now, the good news is it's a rebuttable presumption, which means you can rebut the presumption with evidence to the contrary. So say you could show, well, gosh, that employee also attended a family reunion with 50 people the weekend before. That would be a great way to rebut the presumption. So after that governor's order actually expired on July 5th of this year, but then the California legislature passed Senate Bill 1159, which created a new way to look at the workers' comp, and it says that there's a disputable presumption. So it's not just a rebuttable presumption, it's now disputable, so you can dispute it. So that's the way it would be looked at in California. And then in Wisconsin, for example, there was an emergency order which said that in Wisconsin, indoor gatherings can only be at 25% of total occupancy. So if you're an employer with 100 employees, you might not be able to fully staff all of your places. Now, there was an exception for schools, for political rallies, for polling locations, churches, and some businesses, pharmacies, doctors, grocery stores, and things like that. But there's a limited amount of people that you can have in one location. And then in Michigan, the Michigan Supreme Court looked at the governor's executive orders and nullified them. But then in response, the Michigan Department of Health and Human Services on October 5th issued an order that required face coverings. And then on October 6th, issued 3 more orders related to mandatory reporting of COVID cases that happened at school and in certain healthcare facilities. And then on October 9th, issued another order on face coverings and gatherings. So in Michigan, you've got the Supreme Court saying one thing, you've got Health and Human Services saying another thing, and you've got the governor saying another thing. So that makes it really complicated if you're running a business in multiple states. But we have people who on staff who are more than happy to help you navigate those confusing questions. And then, of course, we have provided a lot of good resources. Like I said, the U.S. Department of Labor has done an outstanding job of keeping everybody in the loop on all the changes that have happened, as well. So has the CDC, and so has Health and Human Services. And then we've attached for you today the forgiveness application for the simple form, and we're happy to provide anything else that I've mentioned today or that you might need to help you navigate all of this new information.
Amie,
So,
wow.
Kara, did we have any questions that came through?
Yeah, what an incredible amount of information, and 43 minutes you did it in. So yeah, we had some good questions. I think everyone's biggest takeaway is the DOL is going to frown on us buying Lamborghinis with our PPP loan.
Yes.
So
yeah,
let's
don't
not
do that.
But a couple of questions that I thought were really good. First, you said that the SBA is commenting about reviewing the loans and providing forgiveness as expeditiously as possible. But what are we hearing as far as how long does it take for the SBA to review a loan forgiveness application?
Well, I think the simple loan applications will come first and be very, very quick. But one of the keys to getting quick forgiveness, it's like with your taxes. If you file and you provide all the backup documentation to your lender ahead of time, you're going to have a lot better luck of getting it processed quickly. But if your lender has to come back to you several times and say, hey, you didn't attach the W-2s for these employees or whatever, it's going to take a lot longer. Personally, I have heard of several people who have already received their loans, their forgiveness information, but these were people who were very well equipped from day one with their documentation. So I'm getting the impression the turnaround's quick. Great. If you're prepared.
Detail is key and documentation. Okay, good. So we have an employer that is doing temperature checks and wanted to know some best practices around the criteria for temperature checks and how they should be record keeping.
Yeah, so record keeping is really the hardest part of the temperature checks because temperature checks are, by their very nature, medical records. So if you're going to do temperature checks, you need to be able to maintain by person in a confidential manner everybody's temperature on the day it was taken, and it needs to be maintained as you would with any medical record. So they're not a bad thing to do, and they are one indicator of COVID, but you could get some false information as well. And whatever you do, to be consistent with the policy is very, very important. If you have a policy that says if you are above a 99.5 or whatever, you must go home, then you have to apply that to everybody, even your, people who are in the, the chief financial people, the people who are, seeming like you really would prefer that they be at work. You need to require the same thing of everybody and keep those records confidential.
All right. Well, Amie, we've reached the end of our time. We had some good questions that we didn't have time to address. So I know after every webinar, our team tries to reach out if someone did ask a question, a participant, and try to get them more information, and we'll try to do that here. And just a reminder that as we exit today, there'll be a survey, and we'd love to have your feedback on some of our future content and what you thought about our presentation today. So Amie, thanks again. Just stellar job with you and the legal team and how you put in our HR team, how you put all this information together, and appreciate you so much. And so on behalf of LandrumHR and HRQ, thanks for joining us today.